Okay, thanks for staying with us here on the Morning Rush. And I mentioned earlier before the break that we're going to have a discussion this one about urine retention, a very important thing that we need to talk about. We're going to look at everything about it, what causes it, how we can, prevent it, treat it, and all of that. And on Wednesdays, as you know, on the show, we have Dr. Sherif Okyeere joining us every day on the show from Amin Scientific, helping us to understand urine retention and what it's all about. But the exciting thing also is that today we want to hear from you, want to hear your input. If you've got any questions, anything like that, you can also call in later on the show. I'll be dropping the number, or it will be on your screen in a while or in a bit as we have the discussion. So you can call in and share your thoughts with us all across Ghana. I know everybody's watching, and of course on Facebook, we are live on Metro TV Ghana. So let's get into it. Dr. Sherif Okyeere, good morning.
Good morning this morning.
Fantastic. You okay?
I'm good. Yourself?
Looking good.
Your hair is looking good.
Are you? It will come, but yeah, thank you. So urine retention.
Yes.
Urine is Johnson. Retention is withholding, right?
Yes.
Something like that. So if you put it together, breaking it down to the ordinary Kenyan, to a viewer out there, in my layman, I've broken it down, but from a health perspective.
Yes. So that's exactly what you've done. So we all know when you look at the urinary system, where the kidneys are, where urine are produced, they descend down into the bladder. So the bladder is where urine are stored until you void them.
Yeah.
So urine retention comes when the bladder is unable to empty the urine, from itself. So if there's a situation where you can't void urine completely, or in some instances, maybe you void and you feel there's still some urine remains in the bladder, and that is when we say there's urine retention. Yes. So basically, that is it, inability of the bladder to void urine from itself. Yes.
Ideally, how is a human or a person supposed to pass out urine?
Okay. So what happens is the bladder is being controlled by certain nerves, and all that, and some muscle contractions and all that. So if the bladder is full to a certain capacity, you understand, then there's activations of some there are some nerve activations which will help, because there's a sphincter, there's a door, you understand. So if it's full to some level, then the brain will activate certain innervations which will help the sphincter or the opening to open for urine to come. You understand. So that is the mechanism. From the brain, there's activation, there's nerve activations, the sphincter will open, and then you void or you urinate. Now, when you are done, there's another activation which will help shut the sphincter, which will prevent uncontrolled urination. You understand? So that is what goes on. So, and at any point in time, for example, when your bladder is full and you're going to urinate, there's a certain volume of urine that is supposed to come out. So in people who have urine retention, when you do a scan for them, what we call the post-void volume, you realize that they tend to retain a lot more urine in their bladder even after urination. So there's a certain volume of blood that you're supposed to void at any point in time. At a point where your post-void becomes more than it's supposed to, then we can also classify you of having urine retention, because in that case, the bladder is not able to empty a certain volume of urine that you're supposed to. You understand? And you see, we all know the urine is a waste substance from the body. So if you tend to keep a lot more urine in the bladder for some time, you tend to breed, infections. You understand? Because it's waste. So that is why it is very, very important that your post-void shouldn't be more. You understand? Especially after urination. The moment it becomes excess than it's supposed to, then it becomes a breeding ground for infections. And through that, there are a lot of complications that has come as a result of some of these situations.
So it means when you have urine retention, it could be acute or it could be chronic.
Yes.
Okay.
Yes. So yes, that is the types, acute and chronic. So with the acute situations, usually you see all of a sudden someone cannot even void urine. They can't urinate at all, and it's common in cases like prostate enlargement, benign prostatic hyperplasia. They'll be rushed to the hospital maybe for about 8-10 hours. They are not able to void urine. Their bladder is full. They can't do anything. And it's very, very difficult situation.
Yeah, it will be uncomfortable.
Very, very difficult situation when you see people going through an acute, urine retention. It's so bad. It's so bad. I've seen men crying, in fact, wailing as a result of that. It's very, very uncomfortable, very, very painful situation. And there's a chronic situation where, it is gradual, they will start by showing signs of, urgency, frequency. Usually after voiding, they feel there's still some, left in the bladder.
Yeah.
And it makes them go frequently. And some people will even experience difficulty initiating the stream. You understand? Yeah. Very, very difficult. They go and there's a lot of discomfort, and gradually it's it stays like that, and it gets to the level when the bladder cannot even void urine at some point.
Yes. First, I used to think that it's the mind. When you go to the washroom, it's the mind you communicate with for the urine to come, because the moment you want to pee, and you are not at home, the pee will know you are not at home. Immediately you get to the house, it will be like pushing you that I want to come out. Or at times when you see water is flowing and you just enter the washroom, it wants to come. So at what point, what consists of its season? Is it that the mind cannot communicate to the bladder anymore, or something is happening?
You have to do.
You see?
Before it comes out.
In fact, when you look at some of the causes of urine retention, there's blockade. So blockade can come as a result of cases with prostate enlargement. When the prostate will become bigger, it will shut the urethra, and now the urine cannot come out. There are situations like urethral strictures. So urethral strictures is when there's mucosal problem, injury within the urethra, and then there will be a stricture which could cause a blockade. And then there are situations like, at the lower abdomen, there are organs that can prolapse. So we have situations like a cystocele, a rectocele, and all those situations where with the cystocele, the bladder will prolapse into the vagina. So when it prolapses like that, it will cause a blockade. Now the urine cannot come out, and it could cause a urine retention. The same way, from the rectum down, some part of the large intestine could also prolapse, and it could cause some of these problems. There are situations like even constipation. There are some situations where constipation can cause urine retention. I mean, there are infections, urinary tract infections, other infections that could, affect this thing, which could lead to some of these situations.
We will be talking about the red flags that actually tells us that, this is urine retention. But then, like this one stated earlier on, the phone lines are open. Dr. Sherif Okyeere is here. Call in, ask any question with regards to urine retention, the conversation we are having. If you've experienced it, how was it, or you've been seeing certain things, signs and symptoms, just call us. The number is on your screen, 055-009-0702, 055-009-0702. So just call in whilst you're having the conversation and just share your experience or whatever question you have for Doc will answer before going.
And also let me just say this, that I mean, once you call, please make sure that you lower the volume of your set and just speak to us over the phone, right? So we can do that quickly. We've got a few minutes to wrap up on the conversation, so you can have your calls coming through right now as you have on the screen.
Doc, like I said, what are the red flags?
Yes, so the red flags are basically restricted to how you void or you urinate.
Okay,
And
Doc, hold on. We have a caller. Good morning, and thanks for calling on Morning Rush. Your name and where you're calling from?
My name is Emmanuel. I'm calling from Joel.
Okay, Emmanuel. Do you have a question, or have you experienced?
Yes, please. I have a question.
Okay.
Okay, so I heard the doctor talking about urethral strictures. I want to know whether there are how do I call it? If you have a urethral stricture, are there remedies for it?
Okay. Okay.
Okay. Emmanuel, thank you.
Yeah.
For calling.
yes, so with strictures, it's very, very dicey situation. It depends on the extent that's got into.
Okay.
You know, in extreme cases of strictures, the best solution is, you know, there should be procedures like surgical procedures to correct those problems.
Okay.
So it depends.
Okay.
It depends on the level that it has got into. So, but I will encourage our brother that if he's been diagnosed of a stricture, I will entreat him to visit the hospital, because usually strictures are caused by injuries or damages to the ureter. So we need to
So he needs to go to the hospital.
to the hospital
To the
to
hospital.
get checked.
Okay. We have another caller. Good morning. Your name and where you're calling from? Hello.
Hello.
Please, your name. Can you decrease or mute your television?
Yes, it's very low.
Thank you
I
very
can't
much.
even hear you from the TV.
Thank you very much. Your name and where you are calling from?
My name is Albertina. I'm calling from Bolga.
Okay. Albert, do you have a question for doctor, or have you experienced urine retention?
Yes, I have a question.
Okay.
Sometimes I feel like urinating, the pressure is there. But when I go, it will take some time before it comes out.
Okay. Okay. Okay.
No, I don't feel any pain. I don't feel any discomfort. Only that, like, it will take some time before
it comes out.
I now initiate. It comes out. Yes.
Albert, please, your age.
I'm 37 this year.
Okay, Doc.
Yes. So so that is one of the red flags when you struggle before you initiate stream. It is very, very important.
Okay. I just, as Albert said, I just want to ask to understand though that is it that when you just go there, it needs to come straight ahead immediately, or you know it could take some 10 seconds for it to come, and at what extent is it dangerous?
Okay, so ideally, what should happen?
Doc,
is,
you know what? Before you answer Albert's question, let's take this last question. Good morning. Your name and where you're calling from?
Pacho metimi country.
Me pacho country na ohunto wa. Udi you baby a free.
Me pacho me say no. Say me soro anopa na me kodware na me dwu nso a. Se me pie ko adwuma. Me num nso say den kra me dwu so biom ko si se me dwu fie. Me nye dwu fie na dwu nso aka me. Bet me da anadwo a ene me dwu so be 3 times na ade a che. Na enu so won fashion bi ana.
Okay. Doctor be answer but one go di ni baby a free.
Your friend Alima to me free blink me.
Okay.
Okay.
Doc, now you can answer the two together.
Yes. So the moment you have the urge and you go to the washroom or you find somewhere to void urine, you shouldn't struggle.
Okay.
So the moment when you are struggling to initiate stream, it's supposed to flow.
Okay.
It's supposed to flow. So, you don't have to stay for 10-15 seconds before you initiate your stream.
Yeah.
It just has to come.
It has to come naturally.
It has to come. You don't have to struggle. The moment, because when you are struggling to initiate it, you know it.
Yeah.
So
if you are struggling, there's a problem.
There's a problem.
Okay.
You don't have to struggle. The moment you get to the washroom, it has to come. And then also, if you realize there's weakness in the stream, it doesn't flow well, and it's not that strong.
Doc, there's another person on the line, but I wanted you to touch on the next caller's issue.
So with the urine, but if you are taking enough water within the day, we're expected that at least every 4 hours you should be able to pass urine. So if you are not doing that, then we need to find out why.
Well, why? Okay. Good morning. Your name and where you're calling from?
Yeah, I'm calling, speaking from Tema, please.
Okay. Kwame, do you have a question for Doc?
Yeah, madam. Thank you for your morning show this morning.
Thank you too, Kwame, for
And
calling
it's
in.
like I'm having a certain problem I would like to discuss with you people.
Okay, does it have to do with the topic we are having now?
Yeah.
Okay,
Yeah.
so ask your question.
Yeah, madam. I'm suffering from that type of condition, which is
Urine retention.
I used to urinate frequently. You understand?
Yeah.
I used to urinate frequently, and I've been to the hospital, and they told me, like I've made a urine sample, right?
Yeah.
But they have not seen anything that is what disturbing me. But whenever I used to urinate frequently, and the doctor told me I should go to the hospital to do a lab this thing. How will I say?
A lab test.
Oh, a lab test. You understand?
Yeah.
Yeah, but it's like the money is not enough.
Okay.
For me to do that.
But what did the test say?
The urine sample, the urine sample did not see any problem that is disturbing.
There's no
me.
problem. But then personally for you, when you enter the washroom, is it easy for you to urinate?
Like, I don't feel difficult to urinate.
Okay.
But the problem is that I urinate frequently.
But now you don't.
I can urinate 7 times in a day, even 10 times in a day.
Okay. Okay, so you are thinking there's a problem with that.
No, I think he said that he used to urinate frequently like that, but now it's not like that.
Come again.
Are you saying that you used to urinate frequently, but now it's not like that?
No, still now, I'm still facing the same problem.
Oh, so you urinate frequently.
So your problem is it a problem to urinate frequently? That's it. Because we want to get the question clearly.
Is it the same thing?
So now I'm saying that is it coming frequently? That's your problem, or you feel there's like it's not normal? Which is it?
Like what I'm trying to say is that I can urinate in a day like 7 times in a day or 10 times in a day.
Okay. We get it now. We get it now.
Okay, Kwame, we get it.
Kwame, we get it.
So I think that, Doc, we have a few minutes to go. So
Yes. Frequency is one of the things.
Okay.
There are a lot of people who have nerve problems and all those who are suffering urine retention. But because of time, if you are watching us this morning and you're having issues like urine retention, you're having challenges with how you avoid urine and all those things, difficulty, frequency, poor stream and all those things, I entreat you to visit Amen Scientific Herbal and Alternative Medical Hospital. And mind you, a lot of times we feel urine retention has to do with just men. No, women can also suffer from this condition, and it's worrying a lot of people. But for now, if you are watching us this morning, I entreat you to just visit Amen Scientific Herbal and Alternative, because we've had, very, very successful, rates when it comes to urine retention with women and men and all that. I think quite recently we had a case where a woman suffered an attack on board. I think she was going to US. They had to do forced landing in Jamaica. When she came, she can't do anything. But from the waist down has gone off paralyzed. She can't control the urine, and by God's grace, she's went back, and she's very, very fine, and there's no problem. Men who had these issues with prostate and all those things, who were in catheter, right now they are out of catheter and they are urinating without any difficulty whatsoever. So what I'm entreating everyone is to look out for Amen Scientific Herbal and Alternative Medical Hospital. Our numbers are on the screen. You can call us. We are all over Ghana. So you just call any of the numbers on the screen and you'll get to Amen Scientific Herbal and Alternative Medical Hospital.
Okay, so we appreciate you calling in this morning. Thank you. But of course, do well to call the numbers on your screen to reach Doc and his men at Amen Scientific, and they could help you with that, with your issues, all the issues that you brought on board this morning. Call him and you know, call the numbers and it will be solved for you. So that's it for the morning. Thank you very much, Dr. Sherif, for coming in this morning.